And welcome to our weekly updates. This is probably be the last of the weekly updates that we're looking to move to bi-weekly as things start to stabilize and information's not changing as rapidly. So, one, it gives you all a little bit more time to get back to your units and work. And it also allows us a little bit more time to make sure we have a clear presentation every week so that we can make sure you're getting the right information in a timely format. Clearly just want to thank everybody for their hard work. There's a lot going on out there. We continue to be in phase 1 of our restarts. Volume is slowly coming up. It's not coming up very fast, but that's okay. We knew that was going to be the fact. We'll keep tracking it. We have created a weekly tracker of volume, and we'll just need to match that up to how we're doing as a comparison to pre-COVID statistics. We'll be getting that out as we get into it every week to the management team so that they can use the information as we move forward. I don't think what else is out there. One, I don't think we've had a spring. We went right to summer. Good, bad, or indifferent. It's very warm out this week, which is a great opportunity if you get a chance to get outside and get some fresh air. So thank you for everything you've done. I'm going to turn it over to John and let him walk us through the presentation today.
All right. Good afternoon, everyone. Thanks again for joining us. Appreciate it. Just have a quick team shout out. This was a note that was sent to us regarding the ICU nurses. It's been up there for a moment, so you guys have had an opportunity to read it while Steve was talking it. And that, once again, the presentation will be sent out to everyone so you can look at it. But a great note of team support, and thanks for the endo nurses for sending this out. Very kind. I'm going to keep moving along here and make sure we have enough time for questions today, so I'm going to move quickly. This is once again the slide. There's 3 data slides. This just gives you a snapshot of where we are in Massachusetts. With you can definitely see the decrease in cases being reported. A little over 90,000 confirmed cases, 6,500 deaths. New reported deaths yesterday was 674. So overall, a good trend. This is really the best slide that we see and we're using to track our progress as a state of overall COVID activity. And the first one is the 7-day weighted average of positive tests, and you can see this is significantly down. And at one point it was well over 20%. So at 8.5%, we're doing well. The number of patients that are passing away, patients hospitalized, and the surge capacity. So this information is updated once again every day at 4:30 at the Department of Public Health website, but a good snapshot of how we're doing overall. This slide is Marlborough Hospital's data, and this is all the COVID patients that have been admitted to Marlborough Hospital. And as you can see, this started back in March 24th, and shows kind of the gradual, slow incline with a peak. And these numbers are snapshots at what time they were taken during the day. I believe our peak was actually 29 patients, right around the same date. So we peaked, and then we kind of plateaued for a while. And I don't want to. We've been fortunate, and we're starting to see a decline. And as of today, we were 15 patients this morning. So we are beginning to see a slow decline of the patients, and we anticipate this continuing the decline for a while. And we'll have to see what the new baseline is. It's not going to be 0, as I think everyone is probably aware of that, but hopefully, 2, 3, less than 6 patients that are in the hospital with COVID, and eventually, just a couple. So we're getting there, and once again, thanks to everyone's great work and help with this. Some updates. So COVID-19 testing updates. So for now, the tents are going to remain open. There's lots of questions about, how long are they going to be open for? What are we going to do with them? What's the long-term plan? But for now, they need to stay open. We still need to do some testing for our community. We need to be able to test our patients that are coming in, and it's a very important tool that we were able to put up, and we need to keep it running. So if there's any changes, we'll update when we end up with some timelines around the future of them. We are using them for pre-procedure testing. Everyone that's coming for a procedure has to get tested, COVID tested, 48 hours prior to the test. So we need them for that alone. We're continuing to work with the system and figuring out how to create standing orders or per policy orders for COVID testing, because it's not just OR and endo cases, but it's going to be things like PFTs, stress tests, and a whole bunch of things that I'm not even listing right now, but or that hasn't been decided on. But the COVID testing, pre-procedure COVID testing is going to continue to be a big part of our future. So lots of work still around that. The tent testing, we had been doing some surveillance testing for patients that had been sent here by the state or our town public health department, and due to our capacity limitations, we're not able to continue to support that. So we are testing anyone that shows up with an order, and that has symptoms. So we're still testing, and we're still testing over 100 people a day. But this is just something that we're not able to fully support in the current state. We want to be able to provide the service and make sure that we can get quick turnaround times for patients that are sick and that are showing up at the hospital. There's going to be some changes in the follow-up process. Right now that's been centralized, and that's going to be getting decentralized, and they've done some things to help support that, but over the next month or 2 months, this is going to be going totally away. And something that's very exciting is that we're moving from nasal swabs to spit testing. There's 2 slides here. I'm not really going to go over. Take a look at them later on. But the key to this piece is that is you have to educate folks is that prior to coming here to do a spit test for COVID, you're not going to be able to have anything in your mouth for 30 minutes. But you can take a closer look at these when we send them out. It is still a PCR test. It's still it's as accurate as nasal swabs. It's run on the same machine. It's just a different way of collecting in a different medium. So this is going to decrease the amount of PPE that we use and how the process a little bit. We'll have to see how the process moves out front, because it does take a couple minutes to generate 2 cc's of saliva, which if you don't have anything in your mouth, it's actually harder to do for 30 minutes, or at least I would have anticipated. So we'll keep you updated and let you know on the progress of that. But lots of really great work by the lab staff here and at the medical center for being able to coordinate this and getting us up and running. So thank you. Just want to point this out quickly. I know there's a lot of hospital staff on the call here. I see it. But this is a pre-procedural COVID tracking dashboard. If you haven't gone there and used it yet, please do so. The key to it, a couple keys to it, is you need to set up location right here so that the area that you're working in or that you want the information on shows up. There's more things here than just this box, but basically it shows the schedule for the next 7 days and the patients listed. So for tomorrow for the OR, there's OR/and I have it set up for a few areas. So it has 15 patients that are showing up in the OR and endo. There looks like there's a couple of patients that don't have their test ordered, percent collected, and result not collected, and completed. And if you click on this button, it gives you a whole patient list and it shows you if the test's been ordered and how the test has been resulted. So instead of having to go in and kind of individually look up patients, it automatically populates this dashboard and can make sure that we're in compliance, because folks that don't get their COVID test or COVID negative can't have the procedure. So it's imperative that we're all familiar with this and understand it and know how to use it. So moving along, some phase 1 updates. As everyone's aware, we moved into phase 1 recently, and with that, as of Thursday, as of the 5/26, we moved the command center to a virtual. So the phone number is no longer active, but we are still monitoring the email. Please, escalate things up to your supervisor, and with administrator on call if it's on the weekends if needed, or if it can wait, you can send it to the command center. But we are slowly taking apart the physical command center. We're working on where to store the equipment and the masks and some of the other things, and that'll be rolled out and communicated out to everyone by the end of day tomorrow. Please, as a reminder, parking. We've been very lenient with parking over the last several months. Please park and employee parking only. As we're going to have patients return to parking, we need the parking lot for patients empty and available for them, so please park in your designated spot. The Joint Commission, as everyone knows, we're in our window for the Joint Commission. The lab is actually past their window for the Joint Commission. They will start doing Joint Commission visits again, they say, in June. I don't anticipate us having a visit anytime soon based on we're still in the state of emergency, and there's lots of things that are not even close back to normal in Massachusetts nor Marlborough Hospital. But we have to start preparing for them and do some intercycling activity to get ready for them to visit, because we do anticipate that they'll be here this year, or at the latest, before the beginning of next year. So while we've gotten our eye off of that for a while, we need to slowly start incorporating preparedness for Joint Commission and other regulatory visits back in. The Behavioral Health Unit is a Tier 1 unit now in the Department of Mental Health, and this is the quick explanation on this is that every behavioral health unit in the state was mandated by the Department of Mental Health to either become a Tier 1 or a Tier 2 unit. A Tier 2 unit is all COVID. A Tier 1 unit, has to be prepared for COVID patients, but is not an all COVID unit. And Katie Masso and Heidi Donlin upstairs did a tremendous amount of work preparing and, doing all of the steps to get this paperwork completed, because it's, you don't have a choice. One way or another, you have to fill in the paperwork and get the work done. And this was submitted successfully, so thank you for them. And if you hear anything about it, that's what this is about. It was just it's basically a DMH guideline of things that you need to have in place to be able to, around COVID. Outpatient services, I have a few slides on this to provide folks with an update on. Annual cardiac rehab. Throughout the organization, we've started to do more outpatient services and add volume back, as we talked about last week. So endo, we've started to do some cases. We are, as I talked about a moment ago, making sure that everyone is COVID tested 48 hours prior to the procedure. Right now, we've had one physician doing up to 6 cases a day, whether it's here or at Southborough. But overall, the process has been smooth, and we're looking to slowly increase that volume, staying within the Phase 1 guidelines. So we have weekly meetings with endo and the OR staff, separate meetings, but we're continuing to talk about them with both of them again this week, and for looking at ways to expand our services and keep getting patients in here. Cardiac rehab opened up to a small group of patients, and a lot of this is for patients that are sick or planning for cardiac surgery, so they really need the rehab done. So the patients were excited. We were able to social distance them and get them in there. So great work by the cardiac rehab crew. OR volume. So there was somewhere between 175 and 203 backlog cases. So as we've started to reschedule them, it's all been outpatient, and it continues to be outpatient. At the earliest, we'd start booking inpatient surgeries with the June 8th, and that's probably very optimistic right now. We do have to wait until the Phase 2 guidelines, and that we're prepared as an organization to be able to admit inpatient surgery. So just to reassure everyone, we're doing outpatient surgeries. We're continuing to look for ways to slowly increase that volume. We've once again being 6 to 8 cases a day total up in the OR, and we'd like to be able to increase that a little bit. But as long as we have the resources and the staff and everything to be able to do that safely and successfully for everybody. And then when things move along and the state gives us the green light and we're ready as an organization, we will then start doing inpatient patients that have to get surgery and then spend the night. So we're keeping a close eye on that, and great work by the OR staff on this. Diagnostic imaging, a lot going on here, and Paul Ruggieri and his group have been very involved in screening patients and looking for folks that really should be brought in. And while they're screening exams, they're still very important to get done. That's how during screening exams, that's how cancers and other issues are found that we need to get folks into. So just because it's a screening exam doesn't mean it's unimportant. So there's levels of screening patients, and the ones that are high risk, we're doing our very best to get in contact with them and get them in. So that's been the focus of radiology. I'm not going to go through everything, but these are the kind of current steps. Phase 1, 518. Phase 2, we'll be able to broaden our screening exams, and then Phase 3, we'll have to see when that occurs. I have a short slide on one slide on radiology volume, and this is CAT scan, X-rays, mammo, and ultrasound. As you can see, this was our pre-COVID March 1st volume, and then you can see the huge dip, literally over a week that occurred. And as we've slowly kind of now been working on bringing more patients in to get them in, so they're not all, they're not sitting there not getting their very important screening exams. So great work, and just to give everyone an idea that it's we still have a far way to go to get back to normal. Employee health, this box on the left, everyone should be bored of hearing about this by now. This is the employee self-reporting app. We're at about an 86 percentile. We range between 86 and 90. We really need to be in the mid to high 90s with this. So please, if you're not filling it out, make sure you're doing the app, or make sure you're filling out going online when you enter the building and fill out the questions that are required to answer for this. This is the mandatory reporting. This is something that we have to keep track of and be able to report, showing that we are screening our staff and making sure that no one's showing up here sick. So if you have questions or haven't heard about it or don't know about it, ask your manager, and they can help you get this loaded onto your phone or show you the kiosk that you can do it. But please get this done. Thank you. Saturday testing for symptomatic employees, we can do that. Annette and Employee Health is working on how we can do this on Sundays as well. Our tent is closed on Sundays, so we can't just have them go to the test tent. So we're working on a different process to figure out how we can screen employees that are symptomatic on the weekend or that are exposed, but we do have a process for Saturdays. Our employee COVID testing has been pretty flat over the last week. We've done a total of 70 tests. We've had 12 positive. 10 of those staff members are cleared to return to work, so we have 2 that are out. But we continue to pay a close eye on that and making sure that if there's anything that pops up that puts our employees at risk, we want to make sure that we're keeping an eye on that. And that's the biggest thing that we caught a few weeks ago was the social distancing and making sure that people are separated, particularly in the break room where they have masks off, or even when they're working in a regular work area that they're 6 feet plus apart wearing their masks. So please remind folks to do that. And if you see people not far enough apart or not wearing their masks, remind them to do so. It's for everyone's safety, theirs and yours. Thank you. Labor pool. The labor pool is winding down a little bit, but it's not going away. And that's the point of this slide, is to show you that while things may seem to be going back to normal to a little bit, there's still lots of things that aren't. We're going to still need to have the tent up and running for another few months at least. We need some traffic coordinates out there, brake coverage. We need folks helping on the label printers. We have a mask cleaning program that's still very active and will be for a while. And we need folks that are going to be screening at patients at the hospital, screening anyone that walks into the hospital. And the visitor screening is a little deceiving because we certainly don't have any visitors in the hospital yet, unless it's a case-by-case basis where someone is at really the end of life. And then we're working with the care team to bring those family members in to spend time with their loved one. So still, state living pool is still active, and we're still looking for folks. And if you're available, or if there's not work in your department, please make sure that you're getting yourself signed up for the labor pool. And thank you for everyone over the last 3 months, 3+ months, who made yourself so available and so flexible getting these positions covered. It's been a huge help in us being successful. A couple just generic reminders: safety, hand sanitizer labels. To make a long story short, all the hand sanitizers in the hospital are totally fine to use on your hands. We have a different brand, so there's a label that's put on it that was for bulk shipping, and that bulk shipping label is deceptive. It comes in 250-gallon vat, and basically if you fall into the vat, yes, you're supposed to shower and take off your clothes, and it's not good for you. That's the same sticker that ended up on the smaller bottles, so we're working on getting those stickers taken off the smaller bottles so that it doesn't confuse or concern anyone. But all the hand sanitizer in the hospital is safe, is hospital approved, OSHA approved, and you will do exactly what it's supposed to from a hand sanitizer. So don't worry about it. Please use it. Thanks. Surgical masks, a question came up about that, and can they be worn greater than 4 hours? The answer is yes. And per CDC and OSHA, they should be replaced if they're wet, visibly soiled, or torn. A couple of great pictures once again from the community, and continue to get support. Great letters. I have a couple other letters that I chose not to read today because I promised that I would not spend too much time talking today, and I'm pretty much at the end of the presentation. But I do once again thank everyone for their efforts, the great community support. And I hope you guys have some questions for us.
All right, John. So we do have one question that's out there. You covered a little bit of it. Since the outpatient services are opening, who will be working in the tents?
So there's a variety of folks. There's still some people that have, as you saw from the volume chart, for example, in radiology, there's still a fair amount of folks that have some availability. And that's what we're looking for, is we can make sure we're working with the managers, working with the staff to make sure that we get that information and we can put them into roles. And if we end up in a bind where there's no one, then we are going to be looking for extra people to do that. But for now, we've been able to, kind of fill it with current people. But that will become a bigger problem for us as we get busier. The greeter position or the greeter role is something that Mike in HR is looking at with Health Alliance, the medical center, and the system of how we can make this a role that in the organization that's standardized, because this is something that we need to do to keep everyone safe walking into the hospital, but it's also a mandate from the state of that we're screening folks that are coming into the hospital. So That's not going away. So some of it's done by the current folks. The greeter position will end up being a temporary role or some kind of role that's added so we can continue to support it. But a lot of this is kind of week to week as we see what happens with available staff.
John, can I add something?
Please.
So I think when we start doing the saliva testing more, it will free up some of the staff.
Yes.
You will not require that much of PPE or people doing the test, so that will change some of the people.
Right.
Yeah. Go ahead, John. Yeah, I was basically going to say, the goal, even though right now our plan is to have the tents up for another couple months, as saliva testing comes online and we can actually allow people to do the testing outside of the hospital and just drop the saliva kit off, we may be looking at different solutions around closing those tents, but we won't know until we are at a point with the saliva process to do that. The goal is not necessarily to have people outside the hospital doing this. We need people in the hospital treating the patients that come in. But right now, the tents are up and will stay up until we have a viable alternative. No other questions I've seen so far, John?
No, I don't have any questions over here.
Want to just open the lines and see if anybody wants to ask any?
All right, I'm going to unmute everyone. He's on mute.
All right. Any questions from anybody? No, we'll give you 5 minutes back. All right. Well, thank you for joining us, and hope you have a great day. Everybody else, have a great week.
Thank you.